The comments and statements made within the show are the opinions of the commentators and their guests, have not been evaluated by the FDA, and are in no way attempt to diagnose, treat, mitigate, cure, or prevent any disease or illness. The contents of this show are not to be construed as medical advice. If you have a health condition or health concern, please contact a licensed, qualified healthcare practitioner.
Hi, everyone. I'm Nan.
And I'm Tom, and this is a Supplement Super Sleuth.
That'll be me. And the herbal storyteller.
And that definitely would be me. And together, we're going to take a peek behind the curtain of the natural products industry.
We'll be sharing naturals in the news, dispelling lots of myths, interviewing key players in the industry, and highlighting our favorite herbs and supplements.
So with that, let's pull back that curtain and see what's there.
Hi there. How's everyone doing? It's the Supplement Super Sleuth. Yep, I'm Nan. And we're here for a little naturals in the news today. Before we dive into the headlines, I wanted to let you all know that I'm making some updates to how we air this podcast. I'm changing the format just a little bit. So this podcast will last around 20 to 30 minutes, but it's going to air more frequently. I want to air it once a week instead of twice a month. And I'm hoping, this is of course my best hope, that shorter bursts of information on a more regular basis will keep you all plugged into what's happening with natural health in our little part of the world. So with all of that, why don't we begin? Or we can listen to the music, which of course we love to do. Or at least I do. Well, it's absolutely the middle of the winter, isn't it? And our skin can start to look a little drab and a little dry, especially if you live at the higher latitudes. And I live in Massachusetts, and even though we've had a lot of rain and it's been warmer than usual, it's definitely have to turn the heat on in the house. And of course, that just absolutely dries out all your tissues. So wanted to share some headlines and some news that might help to refresh your skin during this winter time. The first one, which I thought was really interesting, and of course, this kind of goes back to traditional Chinese medicine and Asian medicine. The headline reads, "Extract of green mandarins or unripe Satsuma mandarin oranges improves skin wrinkles caused by ultraviolet radiation." So skin aging can be caused by various environmental factors, including ultraviolet radiation, but not limiting it to that. So just dryness can too. UVB and UVC are these different wavelengths. There's UVA, UVB, UVC. UVC is mostly absorbed in the ozone layer by the atmosphere, but the UVB reaches all of us on planet Earth and our skin surfaces, and it penetrates to the epidermis and deeply to the dermis. So green mandarins eaten as unripe Satsuma mandarins, they're really sour, by the way, people, exhibit an anti-inflammatory and anti-wrinkle effect. There was a randomized double-blind placebo-controlled clinical study, which I love. Those are those gold standard studies. And the authors of the studies wanted to confirm the skin's improvement and efficacy using the green mandarin extract. Now, you can put the extract on your skin, but this is about eating it as a food as medicine, which we really do like. The authors hypothesized that a standard dose of they're calling it PTE, administered for 12 weeks to patients with UV-induced periorbital wrinkles, which are the wrinkles around your eyes, the kind of the smile lines, improve and shrink the wrinkle depth, the volume, and the length and roughness. Secondary outcome measures included a survey on skin moisture content, transdermal water loss, skin elasticity, and gloss. In August 2020, 1 ton of green mandarins bought from a farmer in Jeju, Korea, were washed, pulverized, and freeze dried. And the green mandarin extract was taken out by normal extraction methods, which we use, alcohol or ethanol. And they measure it. The participants were recruited, and they were females between the ages of 40 and 60 years. And the 80 participants that were enrolled in the study were randomized. And during the 12-week study, the participants took 2 tablets of this extracted green mandarin extract. The study outcomes were measured at baseline, at 4 weeks, 8 weeks, and 12 weeks. Significant improvements were observed in eye wrinkles. So there you go. No adverse effects were reported, which is lovely because when you eat them, they're, just as a fruit, they're really, really sour. So that's something that you can look into if you wish to get your skin to refresh. And then the other wonderful food as medicine is pomegranate. The headline read, Pomelo pomegranate extract promotes healthy skin and gut microbiome. So it helps your insides and your outsides. So the study showed. And this was published in Nutritional Outlook, December 13, 2022. The results of a new randomized double-blind study show that supplementation with a proprietary pomegranate extract was associated with reduced wrinkle severity in a group of 18 individuals between 22 and 55. Now, the 22-year-olds aren't going to have a lot of wrinkles, but once you get into your 40s and the 50s, the wrinkles do start showing. So it doesn't get rid of the wrinkles 100%, but it can really help add a lot to the moisture in the skin. And the new study branded pomegranate extract pomelo shows that those ingredients of the extract may have a beneficial impact on your skin and on your skin gut axis. So it's a really good thing. I don't know if you like pomegranates. I really love them. They're delicious. There was a test group it was a 4-week randomized double-blind placebo-controlled study. We like those. It was an oral supplement of pomegranate. 75 milligrams of punicalagins once daily with 15 females, 3 males between the ages of 22 and 55. So it was a really small study, but it was well constructed. They found that the pomelo subjects showed statistically significant reductions in facial wrinkle severity and a decrease in the rate of forehead sebum excretion. So a lot less oil, but healthier, more moisturized skin with less depth in the wrinkles. So anyway, really great ideas. The researchers also determined that taking the pomegranate caused an increase of skin microflora. And that can really help with acne. And it can also really help with just gloss on the skin. It's really kind of a nice way to refresh yourself. The researchers concluded that the oral supplementation with 250 milligrams of pomegranate fruit extract, standardized to 75 milligrams of punicalagins daily for 4 weeks, significantly improved several parameters of skin health. And it also helped manage gut health as well. So the research can be found in the Journal of Clinical Medicine, published November 14th, 2022. You can go look it up. But pomegranate's delicious. And it's been used all the way back to the Greeks, maybe even farther, in written natural medicine. Really great thing. And it's wonderful for aging women as well. So if you want to refresh your skin for the winter time, you can look into the pomegranate extract or the extract of unripe Satsuma mandarin oranges. Both of those might be something that you can take advantage of. Okay, moving on to the next headlines. I have quite a few pregnant women in my practice. Of course, they see an OBGYN, but they also want natural support, and they want to make sure that they're eating well and taking safe herbal teas during their pregnancies. And so they consult with me. And one of the big conversations that all of the pregnant women that I've worked with over the years express with me is about their anxiety and about the upcoming pain during labor. So I have a news headline for our soon-to-be mommies. And, and remember that this does not take the place of medical support for pain. But it is lovely to know that there's something that you can do if you have a doula or anyone else who's assisting other than your OBGYN in your birth process. This is something that you can think of. The headline reads, aromatherapy with neroli essential oil may relieve anxiety and pain in women during childbirth. Now, this was found as an article in Healthcare, February 14th, 2022. And the title of the research was The Effectiveness of Neroli Essential Oil in Relieving Anxiety and Perceived Pain in Women During Labor, a randomized controlled trial. So childbirth is stressful and it's physically hard. That's why they call it labor and can be very painful for some women. Labor pain is one of the most painful human experiences due to uterine contractions and the extension and the cervical dilation. So why would we do this more and more times than once? Because we forget about how painful it is, and the reward is something so great that it's all really worth it. Inadequate pain management may affect outcomes, sexual functioning, physiological health, mother-child bond. Anxiety may increase perceived pain. So the more anxious you are about the pain that's coming, the more painful it may be. Non-pharmacological means of pain relief, including relaxation techniques, massage, breathing, acupuncture, aromatherapy, are promising areas in midwifery due to their low cost, accessibility, efficacy, and a little of a do-it-yourself. It's, again, very important to have your OBGYN there ready at the ready, but it's always really good to come in as healthy and as strong as possible. So using natural remedies that have been deemed safe are perfectly normal and healthy and excellent way to be proactive about your labor. Aromatherapy uses plant essential oils administered by inhalation with or without steam diffusion, or topically via massage, compresses, or baths. Aromatherapy has been used in labor to reduce stress and perceived pain, as well as during pregnancy and postpartum period. So a combination of orange, which is Citrus sinensis, geranium, pelargonium, that's what geranium is, pelargonium species, and lavender essential oils have been used in labor, but this is the first report of neroli, which is citrus, being used in laboring women. Neroli has antimicrobial, anti-inflammatory, sedative, tonic, aphrodisiac, antidepressant, antispasmodic, and anxiolytic, so reduces the sense of anxiety. Neroli essential oil is used medicinally in gastrointestinal orders, tachycardia, rheumatism, central nervous system disorders. It is the basic ingredient in eau de cologne. All right? And it is a flavoring agent in foods and medicines. Orange blossom water is a heart stimulant and a carminative and promotes sleep in babies. Neroli essential oil was used at 5% dilution in the study formulation. So this was a prospective, randomized, controlled trial used repeating measures. Participants recruited from May to October 2021 at the prenatal clinic University Publique Hospital Federico in Naples, Italy. Included consenting pregnant women between 18 and 40 who were undergoing labor with the fetus in cephalic presentation. So they didn't have a turned baby, they had a baby in normal presentation. Women with maternal or fetal pathologies were excluded. Okay, so pre-study analysis showed that 90% with the essential oil participants in each group were needed. So during the study period, 1,258 women were admitted to the hospital delivery room. 96 met criteria. They were randomly assigned in a 1-to-1 ratio for intervention or placebo. Okay, 4 women from each group were later excluded because they used drugs or epidural analgesia or had to have labor induced. So the data from 44 in each of the group were analyzed. So they had normal labor and natural delivery. Okay, that's important to understand. They had no other drugs. Okay, all participants had routine prenatal care, including emotional support from a midwife and the ability to take free positions during labor, so squatting, walking, and massage and other things. There were 51 prima paras enrolled, an average age of 31. Anxiety was assessed, and pain intensity was also assessed. Women in the NEO had lower perceived pain at all stages of, so this is the essential oil, they called it NEO, had lower perceived pain at all stages of labor versus those in the control group who had significant main effect of that group assignment. So they had a lot more pain, they had a lot more anxiety. Time also had a significant and a large effect size. There was no significant effect of parity. Pain was perceived more intensely as labor progressed. This increase was less in the essential oil group. Similarly, women in the essential oil group had less anxiety than those in the control group. The main effect of the group assignment was large, as was the effect of time, in contrast to pain. So basically, the randomized control trial confirmed the findings of other studies of aromatherapy in laboring women. It assessed only one mode of aromatherapy and one essential oil. And future studies could look at neroli, inhalation, as a possible reduction of pain and anxiety during labor. So I really loved this whole piece because, the women had decided they were going to have natural labor, and the ones who couldn't maintain were taken out of the study, and of course, given what they needed, given an epidural or given support for pain that they couldn't manage. But quite a few of the women were able to manage, and they kept their anxiety down, and they were also able to deliver naturally. So that's pretty spectacular. And this is just inhaling essential oils, which is really kind of a wonderful thing. You don't have to take it internally. You don't have to have someone massage it on you. You can just have it in the room with you in a diffuser, or have someone have a bottle of it and just wave it under your nose. And that could be part of a strategy. I would do it. But definitely for all you soon-to-be mommies out there in my practice who are really interested in ways to reduce your anxiety and possibly reduce your pain, this is something to think about. Okay, moving on to some other really cool headlines. coronavirus is not going away, right? And there are those who get what's called long COVID. It's also called post-COVID fatigue. It can be pretty debilitating for some people. I know that sometimes in my practice, people will show up having tried a lot with their primary care physicians, and with their um, uh, respiratory therapists, because they, lost the ability to breathe. The elasticity in their lungs has really fallen short. And, the fatigue is a problem because it's very hard to get back to work. There are some herbal strategies that are being looked at. The first is a blend of rhodiola, schizandra, and eleutherococcus may improve markers of physical performance in patients with long COVID. What's really interesting about this blend is that this is a blend that has also been studied with cosmonauts and astronauts. This blend of rhodiola, schizandra, and eleuthero is a tonic that's often used for people under enormous amounts of stress. So let me share this article with you. The title of the article is "Efficacy of Adaptogens in Patients with Long COVID-19: A Randomized, Quadruple-Blinded, Placebo-Controlled Trial," that was published in Pharmaceuticals, March 11th, 2022. COVID-19 caused by SARS-CoV-2 can cause symptoms and adverse health effects that persist for weeks to months following initial recovery. We call it long COVID, and it may cause things such as delirium, fatigue, depression, anxiety, post-traumatic stress disorder, which can happen because people don't understand what's wrong with them and they can't get on with their life. And some other neuropsychiatric symptoms. I've seen it trigger bipolar. I've seen it trigger psychosis. And talking to other healthcare practitioners, it can. I mean, if you severely diminish your body's ability to take in oxygen and convert and get oxygen into the bloodstream, you're going to have some very odd and strange outcomes for that. And not all of them have to do with just fatigue. So a lot of herbal preparations that come from the East may alleviate lung inflammation, promote early recovery. A little is known about effective treatment options for long haulers of COVID. So this randomized quadruple-blinded placebo-controlled study aimed to figure out if that using this tonic adaptogenic herb formula could help patients with long COVID symptoms recover. So the study was conducted at the National Family Medicine Training Center in Georgia, from where patients were also recruited from April through October 2021. Patients had a confirmed COVID-19 diagnosis, the presence of 3 long COVID symptoms for at least 30 days prior to recruitment were part of the inclusion data. Okay, so this adaptogenic blend was made from Swedish Herbal Institute, and then also the placebo. Both were orally administered, and the blend contained 180 milligrams of rhodiola, 600 milligrams of schizandra, and 156 milligrams of Eleutherococcus centicosus. So Eleutherococcus centicosus. So that's the formula, and that extract was given to the people who had long COVID symptoms. The placebo contained absolutely inactive ingredients, but had a similar appearance, smell, and color to the adaptogen. All patients were instructed to orally administer their treatment day for 14 consecutive days. The patients were monitored for their compliance, and the primary outcomes included changes in the severity of inflammation markers. So not just, how do you feel? They looked at actual blood markers for inflammation at day 14 and day 21. The safety and tolerability of the treatment was also assessed. So the researchers wanted to know, were there any negative side effects of the herbs? A total of 99 patients completed the trial. The severity of long COVID inflammatory markers and other symptoms gradually decreased from baseline to the end of the therapy, and the follow-up period in both groups. Patients in the adaptogen group experienced statistically significant improvements in walking duration, creatine, which is urinary markers, with no significant intergroup differences for inflammation. So interleukin 6 and C-reactive protein or coagulation D dimer markers. So they only looked at 3 inflammatory markers. There are a lot more, but those didn't change. But their ability to walk and their ability to feel like they had energy did change statistically significantly. So this difference was significant on day 9 for pain relief and day 11 for fatigue. Only one adverse event was reported by a patient. They got allergic conjunctivitis, which is very odd for any of those patients. So it may or may not have been an adverse event. So based on the findings of this randomized, blinded, clinical human trial, the authors suggest that a blend of adaptogenic herbs containing rhodiola, Schizandra chinensis, and Eleutherococcus senticosus can increase physical performance in patients with long COVID, as evidenced by improvements in walking and breathing. So this is promising for those of you who are really, really struggling. And there's one other really interesting headline for those of you who have long COVID. Boswellic acid formulation may improve symptoms and shorten hospital stays in patients diagnosed with COVID-19 or COVID-19 symptoms. So I wanted to share this because Boswellia is frankincense. So a lot of people don't know that. They hear the word Boswellia and then they hear frankincense. And then they say, well, frankincense is really bad to take internally. You're not supposed to take it internally, except that the entire continent of India takes Boswellia internally. So this is a really interesting clinical trial. It's for SARS-CoV-2 or coronavirus. And it's promising. So there's a product called Inflawell, improves neutrophil to lymphocyte ratio, shortens hospitalization in patients with moderate Corona-19 or COVID-19 in a randomized double-blinded placebo-controlled trial. The paper was published in Inflow Pharmacology, April 2022. So Inflow Pharmacology. And is published. You can also pick it up on PubMed. Patients were diagnosed with SARS-CoV-2. They could also be asymptomatic, but if they were experiencing flu-like symptoms, acute respiratory distress, and even other issues, that made them ready for the trial. In patients with severe COVID-19, excessive neutrophil tissue infiltration and formation of neutrophil extracellular traps, which are called nets, can lead to lung injury that can be permanent. And a lot of people have heard this on the news, and they heard this in, medicine, that if the coronavirus gets really bad for people, it can leave scar tissue on the lungs. So there are these pro-inflammatory pathways that are critical in the role of COVID-19 pathology, and we're looking at a lot of natural compounds, and they're being tested in blinded clinical trials. Boswellia is a proven anti-inflammatory, and one of its one of the pathways that it modulates in inflammation is the neutrophils. So it has a profound effect on neutrophil activity and can balance neutrophil activity. It doesn't work like a drug where drugs can actually inhibit, but it can help to balance that. So a study was done at the Shadid Beheshti University of Medical Sciences in Tehran, Iran. The patients who were hospitalized were over the age of 18. They were diagnosed with COVID-19, and they had to exhibit at least one of the following symptoms: respiratory distress, oxygen saturation level below 95%, and or fever. Patients were excluded with a history of liver, kidney, or heart failure. So they're not going to put those people in the trial. And an inability to take oral medication, or if they were pregnant and lactating. So they just took a lot of people out, right? There were 123 patients who were identified. 32 were excluded because then they ended up with a negative PCR test. And then they started the trial. 10 milliliter serving of Influwell syrup contains 333 milligrams of Indian frankincense or boswellia. Okay. And it's dissolved in coconut, basically, oil and water. So that's it. Coconut, oil, water, boswellia. And there was a placebo that smelled and looked and tasted just like the other drug. Patients were instructed to take 10 milliliters of the syrup 3 times a day, and then they were examined. Laboratory findings were similar between the groups at baseline. Following 14 days, neutrophils significantly reduced in the boswellia group compared to the placebo, and the lymphocyte count was significantly higher. C-reactive protein significantly declined in the boswellia group. Serum concentrations of interleukin and tumor necrosis factor were measured at baseline and at day 14. A significantly lower mean of interleukin 6 was in the boswellia group compared to the placebo group. Significant difference in tumor necrosis factor also. And all of those, like, we need tumor necrosis factor, we need interleukin 6, we need these, but they get out of control, and there's kind of your own body attacking the tissue of the lungs because of the level of the inflammation. So what's really promising about boswellia is that it does seem to be able to control, with mild to moderate COVID, some of these inflammatory markers that can be really damaging to the lungs. All patients enrolled in the study had a positive PCR test at the beginning. Following the 14-day intervention, 70% of the patients in the boswellia group had a negative PCR. Only 47.8% in the placebo group tested negative after 14 days. So the authors concluded that there's definitely support and benefit for boswellia, also known as frankincense, formulated as the Influwell syrup. The study suggested that this syrup resulted in shorter hospitalization, alleviation of some of the critical symptoms and inflammatory biomarkers of COVID-19. And the authors recommended that a larger multi-center trial be performed to confirm and expand on these study findings. And that's pretty great. I think it's very promising to know that there are other things out there. And of course, you should see your doctor. If you're sick, you should do a PCR test. We all know the rules around this, and you should stay away from other people because you don't want to spread it. But if you really want to protect your lungs and you're really concerned, and you're thinking, well, I really want to stick to something natural, I just don't want to sit here and do nothing, and you want to be proactive about supporting your body, boswellia is something to think about. Okay, you're probably wondering, who is this person? I'm Nan. I'm the Supplement Super Sleuth, and I've had a complementary and alternative health an herbal clinic for more than 30 years, sometimes full-time, sometimes part-time. I've definitely focused on difficult to treat conditions. And I've also been a spokesperson and educator in the natural products industry for over 20 years. And a lot of the very reputable and well-known companies in the industry I worked for in during periods of time. You can connect with me in person by going to my website, www.watersedgewellness.com. There are a couple of Water's Edge Wellnesses, so I'm the one in Massachusetts. Or you can reach out to me through social media, TikTok, Instagram, Facebook, YouTube. I'll be doing this podcast 4 times a month, sharing perspectives of natural health and healing, news, headlines, interviewing key people and thought leaders in the natural products industry, also in natural health and medicine. We'll be having a natural veterinarian on here soon, a very dear colleague of mine, Dr. Margot Roman, who is an extraordinary veterinarian, has done so much for my pets, and she has so much wisdom to share. So if you wouldn't mind, please subscribe to and like the Facebook page or Instagram, YouTube, or TikTok. Please share our podcast with interested friends and family. Let us know if there's something you'd like me to talk about, to share about, to get some information about. Just add some comments on the social media sites or reach out to me through the website, and I'd be happy to do that for you. And with that, take good care. See you soon. Hey everyone, until next time, I'm Nan.
And I'm Tom.
And we'll have more great topics and guests in the very near future. So join us right here as the Supplement Super Sleuth
And the Herbal Storyteller. Take another deep dive into the fascinating world of the natural products industry.
See you later.